of deep cervical fascia. So this is about the facial layers, and these terms will be frequently used as we move along to the regions. So let's talk about the parotid gland. Parotid gland is the salivary gland, the largest of the three in size, and it is present right here. It is present in front of the ear. It is present below the zygomatic arch. It is present lateral to these muscles. This is anteriorly there is masseter and posteriorly there is digastric. So it is present at this area, just in front of your ear, just below the zygomatic arch. It is present right here, going all the way below the angle of the mandible. So this is the parotid gland, and there is an accessory parotid gland may also be present here. It is shown in the picture right here. This is the accessory parotid gland shown here. It, when present, it is usually present parallel and above the parotid duct. So we will talk about parotid duct shortly. So accessory parotid gland, it's a little unimportant in the sense it is not present in all of the people, but if present, it is present above and parallel to the parotid duct, and with many small openings it opens into the parotid duct of Stensen. And this parotid duct of Stensen, as it moves across the buccinator muscle opposite to the upper second molar tooth, it carries the saliva to the oral cavity. Now let's talk about the relations of the parotid gland. On the lateral aspect of the parotid gland, it is covered by skin, superficial fascia, and investing layer of deep cervical fascia. That here it is called the parotid fascia, divided into the parotid part posteriorly, mesenteric part anteriorly, and actually it should have been here, this particular point, and between the superficial, this is basically superficial fascia is actually superficial muscular aponeurotic system that is on the top of the deep fascia. Okay, so this fascia, this parotid fascia, it is penetrated by the branch. Excuse me. It is penetrated by the branches of facial nerves. The branches of the facial nerves, the temporal, zygomatic, buccal, mandibular, and the cervical, as they move across the anterior edge of the parotid gland and to the surface, to the muscles. So this parotid fascia is penetrated by these nerves. The second thing to remember about MCQs, it's this: it is supplied by greater auricular nerve. This is the nerve that supplies the inner and outer aspect of the parotid gland. These both layer of fascia, and these are the ones that are stretched during mumps. Mumps is the inflammation. In the mumps, there is an inflammation of parotid gland, parotiditis occur. And when it expands, the fascia that is covering the parotid gland, it stretches, and this nerve, greater auricular nerves, carries sensation in the mumps. That's an important question asked historically. So not carries mumps, uh, carries simply, you understand, carries pain in mumps. Not, it's not a transmitter. It carries pain in mumps. Okay, let's talk about the surfaces, its relations. When cut in a transverse section, the parotid gland can be seen to be divided into three surfaces. The one that is laterally, that we just talked about, it's related to the skin, superficial fascia, and deep fascia. The superficial fascia was the parotidomesenteric fascia. The deep fascia was the smooth. The superficial fascia was the smooth SMAS, superficial musculoeponeurotic system, and the deep fascia was the parotidomesenteric fascia. This was the lateral aspect. Medial aspect is divided into two parts. This part, that is the anteromedial. We will be talking about it as the anteromedial surface, and this part that will be talked about as the posteromedial surface. This is anteromedial, this is posteromedial, and this will be the lateral surface. So these are the relations, are the surfaces across which the relations are studied. To just talk about the lateral, let's talk about the anteromedial and posteromedial surface. Anteromedial surface, as you can see, if you have followed the lecture of the temporomandibular joint, you must know that the mandible, the ramus of the mandible, it's sandwiched between two muscles on either side. On the outer aspect, there is masseter muscle, the one that you can palpate right here while clenching your teeth. And on the inner aspect, running in the parallel fiber direction, is the medial pterygoid muscle. Both are the muscles of mastication and both have almost similar functions that includes the closing of the jaw and protraction of the jaw. So you can see these three structures are related to the anteromedial border. What else is related to the anteromedial border are the things that are exiting the parotid gland. That includes this parotid duct of Stensen that is exiting from this surface, anteromedial surface on the surface of masseter, and these five branches of the fascial nerve: the temporal, zygomatic, buccal, marginal mandibular, and ultimately cervical branches. They are exiting from the medial aspect, anteromedial aspect. And there are some branches of the external carotid artery that are exiting to go to the face, that are exiting especially the maxillary nerve, maxillary artery, superficial temporal artery. They are exiting from this surface. So these are the anteromedial relations. So here these are anteromedial relation, and I would like to just mention here the parts of the parotid glands also. The part that is on the surface will be the superficial part, and this part that goes beyond the bones, that goes beyond the mandible here and the mastoid process, and it is the deeper one, that is the deep part. And when we are talking about the deep part, this is the deep part and that this is the superficial part, but there is no very great anatomical breakdown between the part. There is no functional breakdown between the part, so we usually don't mention it, but there is a terminology used: the deeper part of the mandibular, the parotid gland, and the superficial part. We are talking about this, the part that is outside the bones, that part that is present inside the bones between the mandible and the mastoid. And when we talked about the anteromedial surface, we have just talked about both of them. Here we have talked about whole of this surface. Posteromedial surface, now we are talking about this. The easy way to remember is that remember the bones. Here is one bone, mastoid process. Here is a second bone, styloid process. So the easy way to remember is the mastoid process with the attached muscles and the styloid process with the attached muscles. The mastoid process, it gives attachment to the two muscles. We studied them in the first lecture of the neck. That was one, a large muscle, strap like muscle going like this, sternocleidomastoid, and the other one that was going like this and up to the mandible like this, that was the digastric muscle. The posterior belly of digastric and sternocleidomastoid will be related to it, and then styloid process and the three muscles that are attached to it. The three muscles and the styloid process that are attached to it, along with the styloid ligament, that is called styloid apparatus. That is called styloid apparatus. That includes the styloid process, the muscles, plus styloid ligament. So this is the styloid apparatus. So this is related to the posteromedial surface. So it will include the styloid process, the attachment of the hyoid, the stylohyoid muscle, styloglossus muscle, stylopharyngeus muscle, and stylohyoid ligament. So this is a long list that we have covered, and then the structure that is left is just beyond the styloid ligament, just beyond the styloid ligament, about here, at roughly here, like this area, about there. there is the carotid sheath. So we can say that parotid gland is separated by from the carotid sheath by the styloid process. Carotid sheath and its contents, so in this way that can be mentioned in the posteromedial relations of the parotid gland, because that's just related posteromedial to the styloid muscles and styloid apparatus. So we talked about mastoid process and two attached bone muscles, styloid process and three attached muscles, one ligament, and just medial to it the carotid sheath with all of its contents. There are jugular vein and common carotid internal jugular artery at this level, internal carotid artery at this level with the vagus nerve, and we are left with the structures that are entering the parotid gland. We talked about the exiting fibers of the facial nerve branches and the exiting fibers of the external carotid artery branches. So they have to exit somewhere, and this is this surface. The facial nerve is exiting here, and the external carotid artery from down upward coming upwards, it is entering from this posteromedial surface. So these are the structures that are related to the posterior surface, posteromedial surface of the, these are attached to the posteromedial surface of the parotid gland. So here some of the things can be seen here, especially the relation with the digastric and the sternocleidomastoid, and to see the relationship for the deeper structures, that is styloid and the other structures, we have to go to the cross section, that is a cross section at the level of C2 axis vertebra, and here you can see the things. Don't be overwhelmed by the picture, I will break it to you. So this is the parotid gland right here. This is the parotid gland right here. I will shade it. This one this one will be the anteromedial surface. This one will be the posteromedial surface, and this one will be the lateral surface. On the anteromedial surface, you can visibly see here the sandwich of the mandible with on either side. On the inner side there is medial pterygoid, on the lateral side there is masseter. Talking about posteromedial surface, we can't see the styloid process at this particular level, but we can see, let me remove some of the things that I can, but what we can see, we can see the two muscles that were attached to the styloid muscle. So these are the two muscles that are attached to the mastoid process. This is sternocleidomastoid on the outside and posterior belly of digastric on the inside. Then we can see the styloid apparatus, not actually the styloid process, but the three muscles right here. We can see the stylohyoid, we can see the stylopharyngeus, and we can see the, which we are left with, styloglossus muscle. And you can see that just beyond that, you can see the carotid sheath with all of its contents. That includes the internal jugular vein, common carotid artery, and the last three cranial nerves. Not exactly last three, cranial nerve number 9, 10, and 12. Cranial nerve number 11 becomes separated very early on. So this is all about the relations of the parotid gland, the anteromedial relations, the posteromedial relations, and the posterior relations of the parotid gland. Structures passing through the parotid gland, that includes the facial nerve itself and its branches, that forms the pes and serinus. We talked about in just the part 1 of this lecture. Then there is pes and serinus, that is, then there comes the vein, that is the retromandibular vein, that ultimately forms, go down and divides anterior posterior division, and anterior one will join the facial vein and the posterior one will join the posterior auricular vein to form the external jugular vein. Then there is external carotid artery, and not shown here. Here in the deeper aspect will be the associated lymph nodes. Here will be the lymph nodes. So these are the structures that are present in the parotid gland from the outside to inside. And here, when talking about the structures present in the parotid gland, it is good to know that parotid gland is divided by surgeons into the superficial and deep parts by the plane created by the facial nerve plexus. The part that is superficial to the vein are nerves, and the part that is deep to the nerves. Anatomically speaking, the parotid gland, it's not divided. It is a single integral gland, serous gland, integral gland that is complete inside out. So this is more like a surgical landmark than an anatomical division between the two. That is a point to be remembered here. So this is the facial nerve, and the superficial and deep lobes divided by the facial pes and serinus. But the point to remember is this is a surgical landmark. This is not an anatomical division. There is no actual difference between the two parts. Parotid duct of Stensen. This is the anterior border of the parotid gland. Just beyond it, there is a medial intermedial surface. So it emerges near the anterior border from the intermedial surface. It crosses on the surface of the mesenteric muscle. Then, as it comes to the anterior margin of the mesenteric muscle, it turns inside. It turns inside, and it pierces this muscle, that is the buccinator muscle, the cheek muscle. Here in the nettles picture, this part is shown, curved cut is shown here. It crosses the mesenteric muscle, it crosses the buccinator muscle obliquely, and it opens inside the second upper molar tooth. This is molar 1, this is molar 2, and here is molar 3. So it is opening right here, up just across the second molar tooth. So this is the parotid duct of Stensen. Buccinator, you have to remember, it is crossing the masseter muscle and it is piercing the buccinator muscle. And the third point that you have to remember, it is opening across the second upper molar tooth. And if there is a bleed, you can see from here. And surface anatomy, it is very interesting to see. If you look at your ear, there is tragus, and between this and this, there is intertragal notch. This point, between that main tragal point here, antitragus, tragus, and between them there is tragal notch, and this point midline, this is called philtrum. If you make a line between these two lines like this, the parotid duct, it's present in medial one third of this line. And if you clench your masseter muscle and you place your finger, you may actually be able to palpate the parotid duct at hip. This is the parotid duct, and this is the surface anatomy. So because it's a superficial structure, it is not covered by any muscle. It is prone to surgery, especially prone to injury, especially during surgeries or the lacerating injuries on the head and neck. And sometimes there is a tumor of the parotid gland, not a very common tumor, and it's when present, it's very malignant, and when it grows, it includes the facial nerve itself. So it can lead to the facial nerve palsy, and even if it does not, the surgery to remove it may and usually includes the removal of the facial nerve. The bacterial infections that can occur to the parotid gland and parotid duct, they may be due to the recurrent infection. There was an infection in the oral cavity, there was some infection going on, and the infection went back through the opening inside the cheek, and it went back and infected the duct and gland via blood, like in case of mumps, and it leads to a very painful, when parotid glands try to swell, it gets tight and pressurized inside its capsule, and it gives a very painful swelling. And it is present on the masseter, it is present around temporomandibular joint, So any movement for talking and chewing will lead to excruciating pain, and these pains are carried by greater auricular nerve. And then there is phrase syndrome. It happens when in the parotid gland there are two nerves that are very near to one another. There is auricular temporal nerve, the one coming from mandibular nerve coming across the neck of the mandible into the parotid gland and in front, passing in front of the ear. And then greater auricular nerve, the sensory nerve from the cervical plexus that were coming right here. The greater auricular nerve was sensory, and it was uh, this was supplying the sweating areas, the sweat glands and skin of the area over here, over the angle of the mandible. Auricular temporal one was on the other hand carrying the parasympathetic fibers that will activate the parotid gland. So if there is an injury, surgery on this area, and both of these nerves get damaged, there is a chance that fibers of one nerve grows into the other one. So when you are eating, so what happens is that auricular temporal nerve that is responsible for salivation mixed up with the greater auricular nerve that is responsible for sweating. So what happens is that if these get mixed up, the lines get mixed up among one another. When you taste something tasty, the signals parasympathetic fibers that are meant to actually create salivation now lead to sweating because these fibers are mixed with one another. So this mixing of fibers that is called phrase syndrome, and it usually occur after the injury in this region. Arterial supply of the parotid gland comes from the external carotid artery. The venous supply, the venous drainage, it's going to the retromandibular vein. In the lymphatic drainage, it is going into the pre-auricular group of lymph nodes that are the deepest structures present in the parotid gland. Nerve supply, don't worry, it's a little crowded slide, and I will be discussing, you will get an detailed idea of what I'm talking about during the cranial nerve session, because then we would have traced the cranial nerve all the way back from the brainstem to the gland here. But here you for the sake of memorization, some of you will pick it. uh, the supply consists of the parasympathetic component, sympathetic component, and sensory component. Every structure, every visceral structure is supplied for these supplies. The parasympathetic supply is a little tricky. The parasympathetic supply, it is supplied by the auricular temporal nerve, but it the original fibers, the originating fibers are coming from the glossopharyngeal nerve. So the originating fiber are coming from glossopharyngeal nerve. They come from the glossopharyngeal nerve, and from the glossopharyngeal nerve, they enter the middle ear. This is called tympanic nerve. In the middle ear, they form the tympanic plexus, and in the tympanic plexus, they exit it into the middle cranial fossa as lesser petrosal nerve. It then goes through the foramen ovale and it reaches the otic ganglion. I know it's a little tricky, and I know it may not be very easy to memorize it right now, but just listen to it. We will go through this again, inshallah, when discussing the cranial nerves. So, the presynaptic, the first order neuron, the presynaptic, the preganglionic cell body, it is present in the brainstem, in the medulla, in inferior salivary nucleus. It exits with glossopharyngeal nerve. It exits with glossopharyngeal nerve, and with glossopharyngeal nerve, as it comes down to the infratemporal fossa, it enters the middle ear through tympanic nerve. Tympanic nerve, I am having a little trouble in recalling which foramen it enters through, but it may click, I will tell you. It enters the middle ear to supply the tympanic plexus. From the tympanic plexus, it exits as lesser petrosal nerve that comes to the middle cranial fossa. In the middle cranial fossa, it goes over the upper surface of the petrosal bone and it comes down through the foramen ovale along with mandibular division of trigeminal nerve, and it comes down and relay in the otic ganglion. Otic ganglion is present just near the mandibular division of trigeminal nerve. This is where the second order neurons are present. This is where the postsynaptic postganglionic neurons are present. It synapses with that, and the postsynaptic fibers then they move along the auriculotemporal nerve to the parotid gland. Anatomically speaking, here is the lesser petrosal nerve shown in the middle cranial fossa coming down through the foramen ovale to the otic ganglion, and from the otic ganglion, its fibers jump to the auriculotemporal nerve, go back, turn around the mandibular head, mandibular neck, temporomandibular joint, and outside, just outside, it is present parotid gland. It supplies that. So this is the root of the sympathetic fibers. I have summarized it right here. Parotid gland and sympathetic fibers, they in the last lecture of the neck we discussed about the sympathetic plexus that was running, and the plexus it was forming around each of the arteries. So a similar plexus is around this artery that is known as the middle meningeal artery. The middle meningeal artery that goes to the foramen spinosum. So there is a similar sympathetic plexus from the external carotid artery on the maxillary artery on the middle meningeal artery that is going all the way up, and the fibers from these sympathetic fibers from this jump to the auriculotemporal nerve, and they go through the auriculotemporal nerve to the parotid gland. And again, the auriculotemporal nerve is the one that carries back the sensory fibers back to the mandibular nerve, and it gets back to the skull, it gets back to the brain through this trigeminal nerve. So this is about the nerve supply of the parotid gland.